Okay, good evening, everyone. We know how important dental health is in people with any type of diabetes. We also received a lot of questions from the registration form, and Dr. Avanti is here to answer all the questions. It's my pleasure to introduce Dr. Avanti Chandrasekhar. Most of us know her as an active member of Type 1 community, as a grandma to 4-year-old T1 girl, Pari, who is one of our youngest participants of our TOT events. She's a dental surgeon by profession with more than 300 years of professional practice in Mangala Dental Clinic, Mandya. Dr. Avanti Chandrasekhar is well known for bringing a smile to everyone she meets, not just because she's a dentist, but because of her personality. DDS from GDC Mumbai, practicing since last 35 years. She goes by the philosophy of simple living and high thinking and an unending thirst for knowledge. An avid reader, an out-of-the-box thinker, an idea badminton champion, a multitasking mom, a superior doctor, a qualified technical writer, a motivational speaker, a hands-on grandma, and recently she completed a Montessori course from Ideal Montessori. To add to this, she's now a certified diabetes educator from the IDF UK. She's also a social worker. The list goes on and on. Dr. Avanti has many feathers on her cap. Now joined a bonsai club to learn about nature in miniature. So kids are Dr. Avanti's favorite, and she is favorite among the kids. She always believes that every child has a tremendous amount of talent. They only need to be given a little guidance and some push in the right direction. She has a natural ability in bringing out the best in the children she meets or who reach out to her. Her energy and enthusiasm never fail to strike a chord with the young crowd. Dr. Avanti has given numerous talks in various schools and organizations over the years and has been an inspiration to many. Good evening, Dr. Avanti. We are very pleased to have you here.
Oh my God, you could have cut down a little bit now.
No. See, everything is very, very interesting.
Okay, thank you so much. Yeah. Okay, yeah.
Okay. So
I'm actually honored. I'm actually honored that you're actually, I wanted to share all my, all the tips that I could give the kids, because I want everyone to have a very nice smile. I want all our kids to smile, isn't it? Yes.
Yeah. And you already shared a few tips in our previous event, and they're very, very interesting.
Yes.
And we were actually looking forward to your full length session to learn more from you.
Correct. Thank you so much. Yes.
So I'm sharing my screen.
Yeah.
So I hope it's clear. Right?
Yes, I can see it.
Okay.
I hope the others can. Yeah. Okay, shall I start?
You can project it, Sirisha.
Yeah. I'm trying to share it so that it will come my slides. Yeah.
Yes. Yeah, that's better. Yes. Okay.
So she's Pari.
Yeah, exactly. So I just wanted to, because she also keeps smiling all the time. She's just coming to know that she has a sugar monster in her. We've made it a nice story, and she's been but yet she's really taken it very well, and she keeps smiling. So I thought I'll start my PPT with a nice.
I think Dr. Avanti is frozen.
Yes. I thought it's my problem. Dr. Avanti?
Let's wait. I think she has to log in.
Let me try to reach out to her.
Yes, yes. Okay, now I can.
Yes, Dr. Raman.
Oh,
Yes, now
okay.
we are
Oh,
able to.
yes, yes, yes. Okay, maybe is it whether is my internet which is unstable? I don't know. Uh, if there's any issue, you please tell me. Yeah, I will
Sure,
stop.
sure. I was
Yeah,
about to call you actually. You also keep your phone with you. If there is
yeah. I've
any
kept my
issue,
phone.
I'll just.
Yes, yes. And Kshama is also logged in, so she just told me that I was frozen.
Yeah.
Yeah,
Okay.
yeah. Okay. Shall I start my PPT?
Yes, yes. Shall I
Yes.
go to the next slide?
Yes, yes. Okay. Yeah, you can show. Okay, hello, little kiddos. A very good evening to all of you. As all of you know, that a smile can take you miles. That's what they say, isn't it? So, what I feel is, if you want to have a good smile, one thing is you should have a very good temperament or a good mood. You should be always happy. But the other thing, very important thing, is that you need to have a very good set of teeth. Okay, so a very good set of teeth is very important. And today I'm going to share all whatever knowledge I know so that all of you rocking type 1 kids and whoever is joining here will be always having this smile as old as possible till you are fine. Yeah, and the next slide, please. Yes. Yeah. So, actually, can diabetes affect your oral health and your dental health? Of course, it can. No, because diabetes is a disease that can affect the whole body, including the mouth. So, what happens is that all those who are, diabetic are at a higher risk than the normal population where oral health problems are concerned. And this is exactly why we need to be extra careful, and we need to be very alert. Okay, that we don't face these problems and we don't lose our teeth very quickly in life, because then we start getting demoralized. Imagine you smile and you've got two cavities in front your front teeth. No, you'll feel so bad. You'll see have a lot of problems. Yeah, the next slide, please. Yes. Before I go, you know what? I wanted to just share some interesting facts about teeth, and the dental oral cavity. See, half of y'all must not be knowing that the enamel is or I think it has been taught in schools, I don't know, but enamel is the hardest substance of your entire body. It's even harder than your bones. And this is really interesting. The human body or the oral cavity contains more bacteria than there are people on the earth. So just imagine our whole mouth is having so many small bacteria that the entire World Cup population can be fitted inside the oral cavity. So that is really, am I frozen? Yeah. The tooth is the only part of the body that cannot heal itself. So everything else can be healed. Every part, like skin, the bone, and your muscles, and your everything can be healed, but not the teeth. That is why it's very, very important that we need to be very careful about your teeth. And 90% of the systemic diseases, like the heart disease and your many others, like especially the heart disease, and a little bit of healing and some hormonal, everything is connected to the oral health. Fine. Yeah, the next slide, please. And it seems tooth decay is the most common childhood disease that is there. It's more than your cold and viruses and the flus and fever that you get. You are actually having tooth decay. That is the most common disease. And this is really interesting. Okay, see, the average woman, so if you're a woman or a girl, you smile 62 times a day. Okay, but a man smiles for only 8 times a day. I hope they improve after seeing my this. I hope all the dads will start smiling a little more.
I can see everyone smiling.
Okay, fine. And you know what? See, I don't know whether kids know, but most of the ruminants, such as the cows, goats, and sheep, they have no teeth in the upper jaw. So when they are biting, it's only the lower jaw that have teeth that they bite. Okay. And this is the funniest part is the snails. That's why I put a picture of the snail here. The snail has more than 20,000 teeth. I don't know. I just want to go and see a snail once. After seeing this, I want to go and see a snail, how it can have 20,000 teeth. Yeah. And this everybody can try. When your milk tooth falls, you can keep it, wash it nicely, keep it in a dabba, keep it in a showcase, and you'll see that for the next 2,000 years, it will remain the same. It doesn't get spoiled at all. You don't even need to preserve it. So that is the, amazing fact about teeth. Yeah. Can you go to the next slide, please? Okay, so I just wanted, before starting about the way oral health gets affected by diabetes, this is just in a very short. This I'll just show you what is the structure of the tooth. Okay, so you can see here that a tooth, it is like this. It has what you can see on top. That is when we are smiling, all you can see is the crown of the tooth. Okay, but half of it is inside. Fine, so it is not. It is always inside the bone and the gums. So whatever is seen outside is known as the crown of the tooth. Yeah. And then just where, it comes near the gums, then it is known as, that is the neck of the tooth. Okay. I'm just showing you here also. All what you can see outside is just the crown of the tooth. Okay. And below the gums, whatever you can't see is known as the root of the tooth. So here I've shown that here, here there are incisors, canines, molars. These are the different types of teeth that a man has. Okay. And I'm not going to the detail of the dentine and the tooth and all, but you can see that there are blood vessels going inside the pulp of the tooth. So, each tooth is live actually. It has life. That's why when we have a cavity and we start getting toothache. Why do we get a toothache? Because the tooth is live. So you can see the blood vessels going around inside the blood. There's a nerve tissue as well as the blood vessels. And that is why a tooth is a live structure. Okay, though we cannot see it like that. Yes, the next slide, please. Okay, so now everybody knows that in a type 1, we do have these ups and downs in our sugar levels, or even in the type 2 diabetes also, you can have ups and downs in your sugar levels. And the most common things which affects the oral health is the following. Okay, so if you have constant FBS levels, that is more than 180 milligrams per DL, you can lead to so many different things which are very irritating and very uncomfortable. Like you can have a dry mouth, you can have gum infections, you can have dental caries, you can have oral thrush or candidiasis, and you can have bone loss. And this bone loss is where, the tooth becomes loose and it just falls off. And these are all the dangerous things that can happen if we don't look after properly, if we don't look after it, right? Yeah. So I'll go about through each one so that it becomes more clear, right? Yeah. Next slide, please. Okay. So what is a dry mouth? Yeah. Please. Next slide. See, I'm sure sometime or the other you would have seen that like suddenly you feel, or your kid will say that I can't smile properly and I'm feeling all dry around. Because sudden spikes in your blood sugars, or maybe chronically high blood sugars, sometimes because of your growth hormone, you have a spurt in your growth, and you'll have some high blood sugars, then you can land up with something like dry mouth. Or sometimes you can have, if you are going to DKA, as it is called, the diabetic ketoacidosis. And see the other one, a ketogenic diet also can lead to a dry mouth. Okay, so most of us are doing a low carb diet, but you need to see that you don't go into a dry mouth. That shows that like maybe it's a keto, like it's over ketogenic. So just have a look. I mean, just be careful when you're balancing. And most of you all are nutrition. I mean, you have undergone these nutrition courses, so I'm sure you can help. But you can just go through all this because I just know that a ketogenic diet can cause a dry mouth. Okay, but I'm not very clear how. I need to go through it a little more. But it is a very interesting fact that a ketogenic diet can give rise to a dry mouth. Fine. Yeah. The next slide, please. So what all does what all happens when you have a dry mouth? You have a dry, rough feeling tongue, you have cracked lips, and all your inside of the lips, they start feeling all sore, and your gums, you start feeling, oh, it's burning sort of, and you have a lot of discomfort when you're eating, and then you have bad breath. So very often many people will say, I don't know, every time he's brushing and he's doing, but still he's having bad breath. I don't know what's happening. So it could be just the beginning of a dry mouth, so you just be careful, just look out, open his mouth, open the kid's mouth, or whatever it is, and have a look as to, is it that he's going in for a dry mouth, or what is he not drinking enough water? So these are the things which are, the reasons for a dry mouth. Okay, and these are the symptoms of a dry mouth. Fine. Yes, next slide please. So how can you prevent a dry mouth? When normally what happens, when in a dry mouth, it's very subtle. So subtly we may not realize, but once we are aware of it, we'll definitely realize that, okay, we shouldn't go for a dry mouth, because, once you get it, then it takes a little longer time to, become better. So better is to know, as soon as we start, prevention is better than cure. Na? So what we do is, of course, healthy diet, everybody is following. Luckily for us, type 1s, everyone is on a healthy diet. So that is very good. And the other thing what you can do is, this is for the elders, what I have given is, water, you need to drink a lot of water, like say 6 glasses per day. I think kids around 5 to 6 can have something like 4 to 6 glasses per day. And the elders can have, almost a whole bottle, I think 2 to 3 bottles. I think you need to drink a lot of water. Anyway, water is good for health, isn't it? And the elders can eat sugar-free chewing gum. So sugar-free chewing gum is something which has, I think the sugar-free chewing gums are the ones which have xylitol. And I think Orbit comes with a sugar-free, if I'm not mistaken. I think Happy Dent, I'm not very sure. I need to go through this, but I think we do get, which has xylitol and sorbitol. Yeah, these are the ones. Xylitol is very often used. So you go through it so that, and some people say, most of the chewing gums are sweet. And what do I do then? Then what you can do is, chew the gum for some time, spit it out when it is sweet, just spit it out, and then eat the rest of the chewing and keep chewing, If you keep chewing, what happens is, that it actually exercises your gums. Okay, so people say all the time that kid is eating chewing gum, it's not good. But actually we dentists, say, that's why I've written there that the National Institute of Dental and Research, craniofacial, that is CFS, craniofacial research from the USA, has actually recommended that you need to eat chewing gums. Okay, so those who are healthy can eat the normal chewing gums, but even we can eat, I mean, the type 1s can eat, they can eat sugar-free chewing gum. Fine. And it's a very important tip, because if you keep eating chewing gum, then whatever, these crevices which are there in between the teeth, which I would like to show you, that, see here, you can see the crevices, no? Whatever food is stuck here, all when we are eating, we're chewing the gum, no? All that comes to the chewing gum. And then, all of the surface becomes very clean. So that is why, a chewing gum is, it is, actually a very good way of keeping your oral cavity or the teeth crevices very clean. A humidifier is for the dry mouth, is how is, like, because most of the dry areas, or maybe in the summer, it becomes, the whole air becomes dry, isn't it? So you can always have a humidifier in your room, which will keep your this a little very cool and moist. Fine. Yeah. Regular dental checkups and cleanings. Cleanings are, only when it's required, but the dentist do it. I always don't recommend cleaning all the time, because sometimes if there's no need, I think there's no need to go for cleaning. If you're fine, then you must go only for a dental checkup, and you leave it to the dentist and see what he does. Fine. Yes. Next, please. Yes. Okay. So the next one is the gum disease, the gum disease, what gum disease means is that, now we feel that, teeth are the only part. Like if I keep my teeth clean, it's fine. No, always the teeth always come, like how you have you can say like you have a bat and a ball, right? This I'm just because the kids are, so you can't play cricket only with the bat, or you can't play cricket only with the ball, no? So how a bat and ball are both together, they go, no? Same way, the teeth and the gums always go together. Okay, so here you can see in my slide, see the first tooth is smiling happily because see, he's having nice gums, and it's very strongly kept. Okay, and now the other one, that is the second one, you're down, no? Here the whole tooth is completely spoiled, and he's very sad. This tooth is having a cavity. Okay, and so this is not the gum disease. But see down here, this second line, second row, the first tooth, if you can see, all red color, this is the gum of the tooth. Okay, the gum is completely red, means it's an unhealthy gum. Fine. So that is why, once it becomes unhealthy, what happens, like how from a plant, if a little bit of mud goes and, the plant starts shaking. Similarly, the tooth, no, if the strong support is not there, the tooth starts shaking. And now see here, this poor tooth, no, it has become ulta, and it has become little loose. So after some time, this tooth is going to fall, and we may lose the tooth. Tooth is actually, nothing is wrong with the tooth. It's only because the gums could not hold the tooth that this tooth we are going to lose. So that is why gums are as important as the teeth. The health of the gums are as important as the health of the teeth. Okay. Yes. Next slide, please. Yeah. So now you can see here, I've given two things. One is the healthy gums and the other the gum disease. Okay. You can see how the healthy gums, if you just go into the mirror and you just smile, okay, and you just see that your gums will have an orange peel appearance. Okay. So if you have seen the orange, no, the orange has a small, dot, 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 dot. It's something like the appearance of an orange.
I think we lost.
I guess so.
Dr. Avanti is back. She'll be in a minute. Hello.
Okay.
Yeah. Just
I'm so, yeah.
Ah,
I don't know how I got stuck. Yeah. Maybe the internet issue, Yeah.
okay.
Okay. I'm so sorry. Actually, Kshama told me, thank God, she came running. Yes. Okay. Shall I continue?
Yes.
Yeah. Okay. So if you just take you take the cotton and you rub your gums, yeah, and you'll be able to see that there's an orange peel appearance for the gums. That means it's a healthy gum. Okay. If it is, shiny or it is red like this in the other left side, gum disease I've shown, no? If it is shiny and red, and if you just massage your gums, there'll be a little bit of bleeding. That means it is a unhealthy gum. Okay, and that is gum disease. Okay, next slide, please. Yeah, see how the gum infections start. You can see here that the first the top picture, it has all these yellow, you can see this now, the yellow part below next to the teeth, whereas the upper teeth you cannot see the yellow part, but it is there. because the gums are a little red. Okay, but see, down clearly you can see that there is a yellow precipitate which is surrounding the teeth. Okay, this is known as the plaque, and plaque is the one, it is the enemy of our gums. Okay, so plaque is the one which goes and forms a precipitate. I'll give you an example. Like suppose you take a borewell water, and you boil the water, then on your cooker and all, you'll have a precipitate, which doesn't go. Similarly, this plaque, it will go. What will happen is it forms a precipitate which goes and sits on the surface of the teeth like this. So here it will be on all these surfaces. This is how it will. So first it will be just yellow in color, and you'll think, oh my god, suddenly my teeth have become yellow. They were really white. I don't know how they've become yellow, but actually it's not your teeth. That is just plaque, and it's called tartar, tartar. So once you go to the dentist when it's only so thin, the precipitate is so thin, we clean, there'll be no damage to the gums. Okay, but as it becomes more and more, what happens, it'll tell like how in the bus people are sitting, 3 people are sitting, then another 4, 5th, 6th, all are sitting, and then everybody has to adjust. Similar, this plaque and the tartar will say, give me place, give me place. So that poor bone and the gums, they will have to give the place. So I'll give you an idea. See, this is how it is. This is my tooth, and these are the gums. Okay, this is the crown of the tooth, and this is the root of my tooth. Okay, and exactly the gums are going to be like this. This is how they're normally there. Okay, this is exactly how the gums sit in your teeth. Now what happens, the tartar comes and the plaque comes, slowly it will start getting here. Okay, this part becomes yellow, slowly become like this, like this, like this, and look here, so much of tartar. Now what happened to this part of my root? This much of my root has absolutely no support, because this plaque or the tartar has eaten up my support. So what happens, look here, see, from such a big root, half the root has no support, and still a gum is there. So you will think, oh, my teeth are fine, nothing wrong. Why should I go for cleaning? Why should I go? But actually here inside it's like this. Okay, it's a very, very dangerous thing. And so that is why if you see anything yellow like this, first only after, I recommend when you're around 15 or 16, just go to the dentist, not before that. When you're kids, please don't go for cleaning. When you're 15 or 16, you can go to the dentist, and if there is any tartar like this, he will clean it up. Okay, next slide please. Yeah, so what are the signs of gum infection? There's bleeding in the mouth when you're eating or cleaning. You're brushing, and when you're spitting, there'll be blood. Okay, then you'll have red and swollen gums, and all the time you'll have bad breath. So you'll say, I'm cleaning, I'm brushing so much, but yet I'm having bad breath. Why is this? But it's all because of this plaque and the tartar. Okay, so whoever has a lot of plaque and tartar, that is one of the reasons why you have bad breath. But you can also have bad breath if you have some stomach problems, an acidic problem, and those who have a little bit little higher blood sugars, you can have that sweet odor like smell. So the breath is, it can be it has different types of reasons. Of this bad breath is because of the tartar or plaque, as we call it, and the other one is due to acidity, or if you have some stomach problems, even then you can have bad breath. Okay, the other thing is shrinking and receding gums, and you can have gaps appearing, loose teeth, presence of pus, that is, that's an end. And exactly, as Harshji said, that as soon as you go near your child's mouth, or if the sugars are high and if there's ketones, you will have the fruity odor, and you can always say, oh, I think now the ketones must be high. So that is why you must be very careful of the fruity odor, because it's even Pari, we've seen so many times, and in fact we diagnosed her type 1, because one of the this was, that she was going into ketosis was because she had a fruity odor, and it was really strong, and it was quite alarming, right? Yes, next please. Yeah, so how can we prevent this gum infection? One thing is a proper brushing technique, which last time I had shared, but I'll share it again this time. If somebody who has not joined, I will tell you all exactly how to brush your teeth. Fine. And I've been doing this from my last, from the time I joined dentistry. Yes, yes. From the last 35 years. Look at my teeth. All are strong. Yes, yeah. Because I've been taking care of my gums also. Okay. Yes. And you must massage your gums. Last time I've given you this tip that you need to massage your gums. Okay. The way you brush your teeth, similarly, we need to massage your gums. So after brushing, you need to massage your gums like this, just for just half a minute. That's enough. Okay. And like this. Okay. Open your mouth. Okay. Here, little. Just only for half a minute is enough. Okay. Jaldi, if you do, no, that's also enough. So just massage your gums every day. Make it a habit. The way you wash your feet and then go to sleep. Similarly, massage your gums and then go to sleep. Fine. Brush your teeth twice daily. Healthy diet everybody is doing. Regular flossing. Kids and all, I don't really recommend flossing. So I don't know. You can, we'll do that later. Regular flossing. Fine. Next slide, please. Yeah. So this is the ideal brushing technique. We call it the Fones technique, F-O-N-E-S, Fones. You can always Google search also what is this, where the angle of the brush is kept at 45 degrees to the teeth. Okay, so this is how it is. And you put the upper teeth in the lower direction. Yeah, ऊपर की दांत नीचे की तरफ, नीचे की दांत ऊपर की तरफ. So this is exactly what you keep it like this, and up and down, up and down, up and down. Okay, even here it's the same thing. Okay, just a circular motion will not help you, because the brush doesn't actually go, it's not going into the crevices. No, the brush needs to go into the crevices. So I recommend that, just hold it. There are two grips for the holding the brush, and we recommend the fist grip. Okay, keep the this. You can't use a pen grip and brush your teeth. You must always have a fist grip and brush like this. Okay, upper teeth in the lower direction, lower teeth in the upper direction. Open your mouth. Take the same thing. Upper teeth in the lower direction, lower teeth in only the surfaces with which we eat should be like how we wash our clothes. Just brush. Okay, brush. Fine. I hope the kids have all understood how to brush their teeth. So from tomorrow, you are going to start brushing exactly like how I said. Okay. After brushing, massage. Just for 30 seconds. Okay. 1, 1, 1, 2, 2, 2, 3, 3. 1, 1, 1, 2, 2, 2, 3, 3. That's enough. Okay. Just that much is going to keep us real healthy. So that, even your sugars, if they're high also, nothing will happen. Because I'm telling you, important is massaging your gums. I don't want anybody to have loose teeth. No, that's right. Okay, next slide, please. Yeah. So I've just told you, there's no need, the same thing. You can go to the next slide. Yeah. Okay. So after once we know, brushing, we've done all this, and yet, we land up with dental caries, and that is what we call them cavities, right? Cavities. So how do we get cavities? This is one of the most irritating, and it is the dangerous thing, and we can start losing teeth, we'll start getting toothache, and we can't have a good smile, all these things. Cavities can be two types, right? One is because of bad oral hygiene, second is because of hormonal change, and the third is heredity. These are the three things which can cause cavities, right? So you can say, I brush my teeth so well all the time. I've been brushing, I've been clean, I've kept it nicely, yet I landed up with cavities. Why? Because of the hormonal changes. And type 1, you are always subjected to hormonal changes, which is unfortunate, but it's okay. We'll try to combat it, and we'll try to fight this out. Fine? Yes. The next slide, please. Yes. So you can see the stages of the tooth decay. Yeah. So you can see that first, the tooth is absolutely fine and white, right? And then you can see there's a small dot, especially, at this time, that is, it is here. I'll bring it closer. Okay. These are the lines of the teeth. And, those, if you open your mouth, you may see that those crevices, or we call them the sulci. It's a sulcus, we call it. These sulci, they can just have a black dot, just open your, there's all those dots, 1 or 2 black dots, will realize that it is the beginning of the cavity. Yeah, and you still, nothing will happen, even you'll be able to eat. Only when you open, oh, I can see something black there. Fine. Second, third stage will be that it goes little lower, and fourth will start getting stuck. So, there'll be a small, a nut or something which will get stuck. Fine. But you should watch with mommy. No? Okay. Yeah. So you have to, so you see that the second one, there'll be a small hole there. Fine. And that hole is going to be exactly here. And you feel that you will try to take a pin or a pencil, something to take that food out from there, or it will be in between these two. You'll feel, oh, I need to remove it out, like, okay. So that is the beginning sign of a cavity. And even still you say, oh, today I have no time, I think I have an exam, I need to go tomorrow. Or your mama will say, oh, I don't have time, I'll take you next week. Or the dentist doesn't give you time. So what will happen? It becomes worse and worse, and then it reaches the pulp or the nerve of the tooth. Okay, where I said, no, the tooth has life. So once it reaches the pulp or the nerve of the tooth, then we'll get pain, and we say, oh my god, my tooth is paining, and whole night we can't sleep. Okay, whole night you haven't slept means the tooth has reached, the cavity has reached the nerve of the tooth, and then invariably you will have to go for a root canal. So you can always prevent this by going in the first stage. No, if you go to the first stage, then what will happen? The dentist will just make a small cavity, and he'll just make a small hole, and he'll just fill it up. No, and then you will be absolutely okay. Yeah. So always, if anybody has a small black dot, go to the dentist. He will definitely see if it is required. He will do it. Otherwise, he won't. Fine. Yes. Next slide, please. Yeah. So in type 1 kids, you land up with dental caries, as I said, because one thing is, there are a lot of hormonal changes is one of the causes why type 1s are very prone to caries. Okay. But it's not really, and all the sugar levels going up and down, and we won't realize, and then we give them hypotabs on and off, and after giving hypotabs we will not give them water, we may not rinse, because if it's in the night, or we think, oh my god, the child is really sick, it's sad, so that will happen. So normally what we do is we a lot of these type of factors will lead to dental caries in type 1 kids. Fine. So we need to be extra careful about caries in type 1 kids, right? That one thing is, if you're giving a hypotab, especially in the night, or the child is going low, okay, as soon as you give the hypotab or whatever you're giving, please let him drink some water. So just, and drink it off. There's no need to, because already he's so tired, he's feeling low, and you'll feel, what do I do? So just give a little bit of water, just to, and drink it off, right? So that will avoid caries, you'll avoid cavity. But suddenly we won't realize, because sometimes, a hypo is again, followed by a hyper, and that sugar will be there inside the teeth. And suddenly, because of sugar, the bacteria, as I said, the whole world ka population, that many bacteria are there inside the mouth, they will start, decalcifying because of the acid, they will decalcify the tooth, and you will start getting caries, right? That is why you need to be a little more. Next slide, please. Yeah. And see, sometimes, you won't even realize, and see, you will think something is wrong with your eyes, So many come like this, they'll say, I think I got some, something bit me, some bee came and stung me, and all these type of things. But actually, if you land up with this thing, just open your kid's mouth, and he'll definitely have somewhere a cavity which you may have not noticed, and it has an abscess. If you open his mouth, there'll be an abscess full of pus, which the dentist will be able to help you by draining the pus and giving you a course of antibiotics. So we don't want all these things. Now we don't want an abscess, we don't want pus and all these extra things. We can avoid all this, right? So that's why I decided that we need to remember and not go through all this, because we already have so many other things to do, to look after. So these things are absolutely preventable. Fine. Yeah. Next slide, please. Yeah. What can you do for prevention of dental caries, one thing is keep your sugar levels normal, which of course is not completely in your hands, but it's still in your hands, right? Brush twice daily, rinse after every meal. And when you are brushing, there's no need to put a lot of paste, okay? Like they show in the advertisement, no, put lot of long paste like that. No. It is not the paste that is paste, you just put just above that, just how much is required, just like a pea size, only where it's touching the top part of the bristles, right? That's more than enough. You don't need to put a lot of, it's the brushing technique that is important, right? So there's no need to put long paste like this, that whole tube. No. That much is more than enough. And then brush twice daily with the brushing technique which I have taught you just now. Rinse after every meal. And I feel we should rinse after everything we eat, So suppose, suddenly you've been given something, just rinse or drink some water. Visit the dentist at the earliest signs of tooth decay, So, unfortunately, even though you did all this, maybe it is your heredity, blame it on your genes or blame it on the hormones, and you still landed up with a cavity. Go quickly to the dentist and he will be able to, repair it when it is small. We say nip it in the bud. Nip it in the bud. Okay, that is it. Calcium intake is very important because the bone support that's why remains strong, because a tooth is always developed when it is inside the when the child inside the womb only. So in the 6th week of intrauterine life only the tooth starts developing, so the mother has to take a lot of calcium so that the teeth have a lot of proper calcium. So that is why normally they say, please take your calcium, the pregnant mothers and all, because teeth start developing at that age. And the permanent teeth start developing when the child is 2 years old,
There's some issue.
We need to quickly rinse or just take a plain brush with water like this. Fine? Yeah. Next slide, please.
Hello.
Yeah. So when you're sleeping, we don't swallow our saliva, isn't it? So whatever is there in the saliva, some of the chemicals do get precipitate and they form tartar. So as soon as we get up in the morning and when you're sleeping, we need to brush and massage your gums. Fine?
Dr. Avanti, I'm very sorry. I rejoined just now.
Okay.
Hello.
Yeah. Yes.
So I rejoined just now. I'm sharing the screen. I think screen sharing is gone, right?
Yes.
Yes,
Yeah.
ma'am, Krisha.
Yes.
Yeah. Okay, I'm sharing it.
Rejoin matter. Yeah.
Make it full screen. All right.
Do I need to stop at in 10 minutes?
Not necessarily. You can quickly.
Yes. Okay. So shall I take the questions at the end? That would be better.
We'll take it then. Yes.
Yeah. So I can finish that. No? Yeah. I finished this dental abscess. Can we go?
Okay.
Yeah. This also I finished. Okay. Oh yeah. No. Oral thrush. Come to oral thrush. Okay. I think somebody has asked me a question. I hope you understood. Did you understand? Tartar?
Yep.
Yeah. Okay. So you need to brush upper teeth in the lower direction, lower teeth in the upper direction. Massage your gums nicely. And at the very beginning sign of tartar, please go to your dentist. He will help you. Fine? Okay, oral thrush is, nothing but, it is candidiasis. It's a fungal infection. So the difference between a dry mouth and oral thrush is a fungal infection, which is really difficult. If it starts, then sometimes it takes ages, it takes months to go. So we need to be very careful that we don't land up with any oral thrush, fine? And this is how it looks. And sometimes you can land up with it, if you have these fluctuating blood sugars. Next slide, please. Yeah. So, the thrush is a yeast infection, or we call it a fungal infection, which is known as Candida albicans. And it affects most of the warm areas. You can also have it in all other private parts, etc. and all. And also in the mouth. So I'm going to concentrate about the mouth. Okay. And it is only the high sugar levels which will always, promote these yeast or the fungus to grow. Okay. So we need to keep our sugars under control. And if it hasn't happened, then you can land up with thrush. Fine. Next, please. Yes. So what are the beginning signs of a thrush? Okay, this one is a bad thrush which was there, but there is, the beginning sign is that you start getting a bitter taste in the mouth, and at the end, here many will say, I can't open my mouth, I can't open, and they'll say here it's dry and it's bleeding in this area, or there'll be a creamy white colored patch in these areas, or you'll have a painful sore mouth. Okay, and there'll be cracks in your corner of the lips. This is a very important sign. Okay, the child will have cracks in the corner of the lips, which is almost the first sign of candidiasis or oral thrush. Fine. Next slide, please. Yeah. So what happens is, even though it's not serious, it's very uncomfortable. And if you leave it, then it can land up with serious, and it can go into your systemic this, and it will create a lot of havoc. Normally, oral thrush can be treated with antifungal creams, or also, you can have these thrush treatments. You go to your doctor, he'll definitely prescribe. I recommend that
I think Dr. Avanti,
yeah,
it's frozen. Just
yeah,
lost that moment.
I was frozen. Correct. Yeah. Okay, fine. Okay, so what you need to do is recommend everyone, like please, the mothers, keep applying either Vaseline or a little bit of butter. Keep applying so that the lips are always healthy and nice. Don't allow the fungus to grow. Okay. Yeah, we just saw, when we diagnosed Pari, she had oral thrush in the corners of the mouth, and because her levels were very high, and then of course we had to apply these oral thrush ointments. But after that, now we're very careful that we haven't repeated it again, because then it takes a long time for it to become all right. Fine. Next slide, please. Yeah. So what we can do is, keep a good dental hygiene, brush twice. Everybody knows that. Use a mouthwash. No need of using a mouthwash every time. Kids, I really don't recommend mouthwash. Please just rinse your mouth after eating. Okay. And another one important thing is, that's why I've made it highlighted. Kids should have, they should be prevented from having very close contacts with the pets. Yeah. Pets will come and they lick and all, for the others. Even normal kids also can land up with thrush, but we need to be extra careful. We don't want this thrush. So please, don't allow your pet to lick you here, there. And like we have two Dachshunds, they come, they start jumping, and they look that nose and everything, their saliva. So we can land up with oral thrush. Fine. So be careful and prevent your kids from close contacts with your pets, right? Regular visiting of the dentist. That is, anyway, it's always. Next slide, please. Okay, so this is another very important part, but since I'm just targeting the kids, I'll not tell much about this bone loss, because bone loss it comes if you are after a long time, say 30 years, 40 years, then you can land up with bone loss, and you have fluctuating blood sugars, and so I'll just throw a little bit of light. but I'll not really cover this because most of the kids will not land up with any bone loss. And it is, long-standing type 1 or long-standing diabetes you can land up with bone loss where, your whole tooth will have no bone at all, absolutely. And, this bone loss can be because of tartar, it can be because of your plaque, and also because of your high blood sugars, you can have a bone loss. It's not only in the teeth, you can have bone loss everywhere. So, bone loss is directly completely proportional to the your fluctuating blood sugar. The higher the blood sugar, the more will be your bone loss. Fine. Yes. Next, please. Yeah. So see, you can see here how, see, the left side, it's a healthy gum, healthy tooth. Look at this. I had shown you how it's, nicely sitting there. But look at the other side. As I said, it's gone like this, and the tooth is completely decayed. The tooth is right from top, it looks nice, but look down, the root is completely spoiled. So now, after some time, it will start shaking and it may just fall off, or it will get infected. You can get pus, you will get an abscess, etc. Next, please. Yeah. So now I feel I've covered all the different things which you can get due to your type 1. So now I'm sure all of you are going to take extra care of doing everything. So now I'll just give you 5 golden tips for a best smile. I call it a best smile, because we need to have a smile, isn't it? It should be our best smile. Target your A1C less than 7. For kids, I know most of you all are having 5.9, 6 and all. It's amazing. I'm always, so proud when they share their, this, that, they are 5.9, 6. But less than 7 is fine. It will not trouble your teeth. You will not have any dental problems any more than what the others have. Fine. Drink 8 to 10 glasses of water per day. Please brush and massage your gums twice daily. Okay. Visit your dentist twice in a year. Okay. I just forgot to write twice in a year. It is written twice, but not every day. It's twice in a year. Fine. And drier months should have a humidifier if possible. Yeah. Okay. Next slide, please. Yeah. Now, see, there are some misconceptions about these type 1s and generally about diabetes, that people think that, people with diabetes are at a greater risk of dental cavities, but actually, if your diabetes is well controlled, you will have no more tooth decay or any gum disease. Periodontal means gum disease than people without diabetes. So please don't be scared. Okay. Just keep your sugars under control and you'll be as good as the other person who's on next to you. Fine. People with diabetes lose their teeth more often and sooner than people without them. Absolute crap, I tell you. Practice your good oral hygiene habits and you can eliminate the risk of tooth loss. It will be as much as the other. So good oral hygiene habits are extremely important. Fine. Yeah. Next slide. Yeah. Now, like I just, somebody had just said that should we be concerned about the sugar in the toothpaste, but the American Dental Association has made it very clear that flavoring agents that cause or contribute to tooth decay. I'm frozen again. Yes, I'm back. Yes. They are not normally added to any toothpaste which is ISI. It has a FSSAI mark or it is certified. Okay, it is either FDA certified or IDA certified. Then it will not have any sugar containing this. It will have all the others. Especially if you just share my next slide, I've given you the ingredients of a toothpaste. Yes, like you have sweetening agents such as sodium saccharine. Okay, that is more potent than regular sugar, but it does not actually match the criteria that is considered as cariogenic foods. Okay, so it is technically not sugar and it is not cariogenic. So many people think that, oh, we are diabetes, should we not use toothpaste? No, you can, because the American Dental Association has got it's either a sorbitol, and sorbitol is a sugar alcohol, and that is also there. It's one of this, and polyol, that is very similar to erythritol. Fine. So there's no need to be scared, and none of us, we are not consuming it now. We are just brushing and we are just throwing it. It is just used as a preservative sort of. Yeah, next please. Yeah, I don't want to, these are just toothpaste ingredients. There's nothing like that. I mean, there's no need. I just wanted to show you that these are the things in which, all the ingredients are there, out of which I just wanted to highlight, the third last, that is humectants, including glycerol, xylitol, sorbitol, polythene glycol, and propylene glycol. Fine. And so most of them, none of them are actually supposed to be carcinogen, right? Yeah. Next slide, please. Yeah. So, see, this is exactly, I hope I haven't bored you all much, but I really wanted you all to know a lot about the teeth and your oral cavity and this. So, see, now I feel when life gives you 100 reasons to cry, you can show life that you have 1,000 reasons to smile, isn't it? So we have so many other reasons to smile. And now we've got such a lovely group. I'm so proud of being a group. And most of you all, they're your inspirations. I see each one and I'm so inspired by each one of y'all that I have decided that I have 1,000 reasons to smile. Yes, stay positive, kids, and you work your way towards their best teeth. So you have a very healthy smile, right? Yes. Next slide, please. I hope I've finished. I don't know if anything is left. Next slide. Yeah, okay. Any questions? Okay, fine. That's me. Okay, I've just given my best picture. Okay, I don't think I look so good now. It's a little younger that time. But, if anybody has any questions, I can see 5 questions there.
Where does starter start from?
Tata exactly starts from, if we can go to my, that's, yes, Shirisha, if you can go to my gums, I think it's the, yeah, I'll show you exactly, because I think he's joined a little late. A little ahead, yeah, a little more than, yeah. Yeah, no, no, not this, not little, next. No, not ahead, lower.
Oh, okay.
Yeah, lower, I'll tell you. Yes, see, can you see that no, the earlier one, the earlier.
Yes.
Yeah, okay, can you see this?
Yes.
Yes, you can see the yellow part which is there in the teeth.
Yes.
Yeah, that is called the tartar. Okay, so it starts like this. In the beginning, it is just a thin film, it's just a thin film which is invisible. Okay, and it is just lying there quietly here. Okay, because we won't realize, but we'll find it a little greasy, and it won't be nice and rough. Okay, and you won't have that orange peel on the gums. So this is where you feel a little, that, oh, there's a lot of saliva here. You'll feel at this area. So it starts between the at the neck of the tooth, between the root and the crown of the tooth. This is where exactly it starts. You can see the yellow thing, isn't it? That is tartar, right?
On the upper side or on the lower side? Because for me, my torch is on the lower side.
Yes. The lower side, it becomes faster because we have below the tongue. Below the tongue, we have a lot of salivary glands. We have bags which contain saliva. So, a lot of saliva comes in the lower side below the tongue. Okay. So, that is how the lower teeth tend to get tartar much faster than the upper teeth. But then you need to go and you need to get it cleaned and then see that you don't again get tartar by having the right brushing technique, right?
So I've had it clean 2 times.
Yes, no. Now you know what you must keep your brush at a 45-degree angle and brush the upper teeth in the lower direction. Don't allow the tartar to form and massage your gums. Fine.
How do you massage your gums?
Just take your this finger, and open your mouth and just massage like this. And you'll get some sound. If it's really clean, you'll get a sound, that, okay, it's clean. Otherwise, it'll feel very sticky. If it is really a very healthy gums, then you'll get a sound, you'll get a sound where you can make out that your gums are healthy. If you don't get the sound, you get bleeding. That means your gums are not healthy. Keep massaging. After 1 week, your gums will be healthy. Fine?
May I know who asked this question? The name of the kid who is asking.
Yeah, I know he had such a sweet voice. Who was this who
Yeah.
asked this question?
Okay.
Yeah.
One more thing, Avanti ji,
Yeah.
we are pleased to have Ms. Usha Dhiman, who has been T1 since 61 years.
Okay.
So she's here.
Yeah.
Usha ji, you wanted to ask something or you want to share something? You can unmute yourself and
Yes, yes. You
talk.
can show your video also. Yeah, yes, yes.
Okay. Hello.
Yeah, yeah, yeah.
Yeah.
Yes,
I,
yes.
I basically wanted to know that once I was asked to, I lost, I mean, after what do you call root canal, they wanted to put a false tooth by
Implant.
surgically
Okay,
implanting.
implant. Yes, yes.
Is it safe for a diabetic?
Actually, for a diabetic, if your sugars are well under control, are you type 2 or type 1?
Type 1.
Type 1. Okay.
Yeah.
And how is your bone structure? I mean, is it really nice and fine?
Yeah, it's fine.
Yeah, because the implant normally depends on the bone structure. So if
Okay.
you are if your sugars are under control and you have a nice healthy bone structure, then the implant will stay fine. But it will not really. So you need to go to a proper implantologist who is going to have all the procedures which are absolutely sterile, right? So just
Yeah.
because now every third dentist is saying I'm an implantologist, and I really don't recommend every implantologist because you need to go to a proper implantologist. So even if so what the actual implantologist will do, he will take a proper x-ray and he'll see whether your bone support is fine. He will check whether your sugar levels are fine, and he'll check whether this too. And we also need, when we are biting, exactly when we are biting, we need this space. So when you're opening, this space should be enough for the implant to stay. Okay. So without, judging all this, and all these parameters should be calculated. And then, if the dentist is fine, he will take it up for an implant. Otherwise, you please don't go for the implant. Fine?
No, yeah, actually, my sugars are not all that stable. Like, so he was suggesting like they implant a screw or something with that.
Yes, exactly. They
Yeah.
put a screw inside the bone.
Yeah, so I didn't go for that. I just went for what do you call?
A bridge. You went for a bridge.
Not even a bridge, just a false.
Removable.
Removable, yeah. True.
Yes. Always removable is a safer one because it is non-invasive, no? So if you're comfortable with a removable partial denture, I am from the old school of thought. You can imagine I'm from the 35 years ago I've done. So I'm from the old where I believe in conserving our structures. Yeah. So if somebody comes with fluctuating blood sugars, I will tell them, please don't go for an implant. Because after spending 30,000-40,000, after 6 months that screw will fall off, or you'll land up with infection. So what is the use, na? Yeah.
Exactly.
Yeah. So it's okay. Yes. If you're comfortable with your partial denture, you please continue with it.
I'm fine.
Yeah. Nothing. No worries.
Thanks a lot. Thank you.
Yeah. Yes.
I'll stop sharing screen for a while and let's take questions from the chat.
Shirisha, I just wanted to share that upcoming event, that last one. We didn't put that.
Yes.
Yeah, we'll just share that off. And then we will take up the question because everyone needs to know what Harshi is doing all the time. He's one great
this is our
inspiration for
upcoming event, everyone. So we are going to have interview with Harsh Kohli on 25th September. This is coming on Saturday, 5 p.m. It happens that it is his diversity. So we are very happy to have this interview on his diversity. So everyone will send the registration form and everything. So please join.
Yes. And he is going to have it with his son, isn't it? He's going to share his son's journey also, right?
Yes.
Yeah, good. Okay, Harshi, I'm looking forward to it. I'm going to join you, right?
Thank you, ma'am. Thank you so much.
Yeah. Yes. You are one inspiring person, and you're there for all the type ones. I'm telling you, even you have helped me also. No, I also asked you.
Yeah, thank you so much. Always.
Yes. Okay, I'm ready to take up the questions now.
So, Dr. Avanti, this is Madhu.
Yeah.
we've received some questions and we shared with you. So
Yes.
we'll go through them first and then we'll check the questions on the chat also.
Correct, correct. Okay.
So the first question is about the discoloration of tooth.
Yes.
Any precautions that is to be kept in mind for type 1s when they go in for dental procedures like filling, braces, root canal, or even simple cleaning? I mean, do we have to be really extra careful when we go to a dentist? And
Yes. Okay. So the first question was about discoloration, right? Yeah. So, you know what, I don't think, because of your diabetes, you can ever get discoloration. Discoloration is entirely either it's a beginning of a cavity, okay, as I showed in my picture, where the type 1s are having, slight light brownish discoloration, which could be only because of beginning of cavities. The other thing is you can have these, line discoloration in all the teeth, no? You can have these lines of discoloration. That is because either it is because of your iron. It's called stains, okay? They are not, it is not discoloration. It is just stains, which is superficial. And it is either, if you've taken iron tonic, which is a hematinic, and if you've just taken the syrup like this, which has touched all your teeth, then it can form a layer, which is light brown. And that is called a stain. And that can be removed by the dentist, fine? So that is not anything concerned with the type 1 diabetes. It may be that you have used a mouthwash like chlorhexidine. Some people get stains because of the chlorhexidine, or it could be because of the iron tonic which you may have taken, right? It's not because of the diabetes, right? Yes.
And when we
What
go
was
to
this?
a dentist, do we have to be extra
Careful? Yes. You need to be very extra careful. As soon as you go, you please tell him that you're a type 1 diabetic, so that anything, by mistake, if he has if he's very busy and he hasn't sterilized anything, you let him be extra careful, is it? We don't want we don't want the dentist to make all these silly mistakes. I have seen many dentists, they have just 2 or 3 mirrors. We have 80 mirrors, 80 probes, 80 tweezers, and we sterilize it in the morning, we autoclave it, and then we give it, but there are many dentists, they just have, 5 to 6 mirrors, 5 to 6 probes, same thing will be used, they'll put it in the Dettol and again put, so we shouldn't do all that. It's a problem, of course, but we need to be careful, and we should tell him that I'm type 1 diabetic, so please be extra careful. One, okay. Second thing is, don't go for cleaning every now and then, please, because according to me, once in 2 years it should be enough, fine? And if you really don't have a problem, you please don't go for cleaning, because we use the scalers, no? So we have to be very careful when you are using the scalers. By mistake, if we are touching your gums, then invariably by mistake, I can just harm your gums, isn't it? So I need to be very careful. So what you do is massage your gums nicely, the tartar will not be there. Go for cleaning. Ideally, they say once in 6 months, but I feel once in 2 years, more than enough, right? Yes.
Right.
Yeah.
So, any recommendation for a toothpaste for kids with type 1 diabetes?
No, type 1 is the same tooth, like any Kidodent, Pidoflor, all these which are there for the regular people, the same toothpaste. Only don't use lots, just use a little bit, right?
Okay.
Yeah.
And then somebody asked their child's tooth fell in a gap of 1 week. 3 tooth.
Three teeth, yeah. Maybe he just got a growth spurt. See, at 6 years, the front teeth fall. Okay, the front teeth fall at the age of 6 years,
Okay.
and at 7 years, the upper front teeth fall. So maybe 1 or 2 altogether fell, and at 11 years, all the molars, one by one, tap 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 tap, they fall. So maybe it is just that that age-wise the teeth fall. No, it's not an issue at all. It is not that because of his diabetes it fell. Yeah,
My
it's just
daughter is
because he
also
grew.
concerned. She's 11 years old. She's 10 years old and coming to 11. She's saying, I still have milk teeth. What do I do now? I said, don't wait. You can't do anything. You have to wait.
It's nice, it's good. The better, if your permanent teeth come later, the better for us. Why?
Okay.
Because the permanent teeth will last for a longer time. No? Yeah.
Okay.
And
And
that
I
means
have-
she hasn't.
Yes, please continue.
She hasn't got a growth spurt. If she gets a growth spurt, the canines will come the last. Okay, canines will be the last to fall. So they come at the last. Yes. Yeah.
Okay. I have 2 more questions here.
Yeah.
The first one is for filling of the cavities.
Yeah.
Dentists suggest different types of fillings, right?
Yes, yes,
There
yes.
are different,
Yeah,
different
yeah.
models, different.
You have
grades.
silver. Yeah, you have a tooth
Yes.
colored. You have tooth colored. You have silver amalgam, and then you have a light cured material. Correct. Yes, yes, yes. So
What is the best one?
see, according to us, the best one is silver amalgam. Okay, that is the strongest. But the problem with silver amalgam is that when you open your mouth, it looks black in color, right? So now the newer generation, nobody likes those black. Like I have, 30 years back when I was doing my dentistry, I have some 2 silver amalgam fillings. They're still there. Okay. So if I laugh loudly, you can see my silver fillings, right? But many people know nowadays, when they're laughing also, they don't want that black. The younger generation kids, the college children, no, they all want, aesthetics, cosmetic, aesthetics. So that time you have to go for a tooth colored material. And now dentistry has advanced so much that you have very good materials which don't fall fast, So you really have. But the problem in India is that everything we have to bring it from abroad, So everything is costly. That's the only thing, because nothing is manufactured in India. Okay.
Yeah.
No dental materials.
Also, one question is that the cavities, amalgam that you have said,
Yes.
over a period of years, does it cause any health issues? Because that is there for so
Yes.
long.
No. It doesn't cause any health issues. The only thing is the filling itself can become a little old. So what it has a micro leakage. Okay. So if this is your filling and this is the cavity formation like this, there can be a micro leakage like this from where the bacteria can go in, and so there will be a little bit of cavity just below the filling. And you may think that, you will think that, even though I have a filling, I'm getting some sensitivity. I'm feeling boom sensation. So you'll think, why is this happening? Just go to the dentist. He will come to you, he may take an X-ray, or he'll realize that maybe this filling needs to be repeated. Okay. So after some 10 years, sometimes we do repeat filling if they have a problem. Yeah.
One question, if the tongue cleaning part which is there, which the children do,
Yes.
Is it really relevant for the tooth health as well? Because there is bacteria on the tongue as well. So is it important that tongue has to be clean all the time?
Yes. Yeah. No, actually, according to me, the tongue cleaning is not really but yeah, it does help in oral thrush and all that. No? But there's no need. I mean, you can just clean it once or twice like this. But even if you don't clean and you just rinse your mouth well, all the taste buds, every 8 to 10 days, the taste buds fall and new taste buds come. Okay, so that is the science about the taste buds. So the top of this keeps changing, it's not the same thing. But tongue clean, it's a good habit, but it doesn't really make much difference to your oral hygiene. Yeah.
So someone was asking about the fillings again.
Yeah.
If there is no issue with the whole fillings, we don't have to worry about it, right?
No, we don't have to worry. Yeah, I've got a 20-year-old filling, at one place.
And then somebody asked, okay, this is my question actually. With younger kids, actually, they play a lot in the evenings and in the mornings, right? And usually when they play in summer, they hit lows in the night.
Yes.
So when we give glucovita or some glucose to lift the sugars up, how do we counter that effect of giving sugars while sleeping? I mean, we can't ask them to rinse their mouth.
Yes.
Sometimes they do, but sometimes it's not.
No. What we need to do is, tell them not to bite the glucovita. Let them just, don't chew it or don't bite it. Just suck it sort of,
Okay.
so that it doesn't, it only touches the palate and the tongue. So let them just suck it. Let them sit straight and suck it. And just keep sleeping and sucking it. That's it. If they chew it, then it touches the teeth, isn't it? And then just give them a glass of just two scoops of water. That should be fine. Yeah.
Okay.
Yeah.
And then let me look at the questions in the chat window. I think we'll just take a couple of minutes here. Which toothpaste do you recommend for T1D children? Yes, we did that. Is it safe to get a surgical implant of tooth for a diabetic?
Yes, I think the Susha, I just told her the same thing. She was the same
Yeah.
person. No? Yeah.
Yeah,
It's,
yeah.
okay. Surgical implant is the same thing, and it is. It depends, like surgical implant, that depends on your diabetes. It's very, very difficult to say. Depends on your levels of the sugars. How bad you are as a diabetic, because surgical implants depends on that. Yes.
And then somebody asked about the tartar, which you covered again.
Yes.
Then my question was, can 80-year-old chew the sugar-free gum?
Yes.
Okay.
8-year-old can eat. Definitely. Yeah.
Okay.
The only thing is, I'll tell you one thing about the 8-year-old is the 8-year-old will have just 4 permanent molars. Okay.
Yeah.
Because the second permanent molar comes at 12 years. So the 8-year-old will have only 4 permanent, one year, 1 year, only 4 permanent molars. All the others are milk teeth. Okay. So actually it doesn't make a difference.
Okay.
Yeah, all the others are going to fall, right? So after that, so I normally say, by 12, most of your permanent teeth would have erupted. And then after that, you maintain the hygiene, should be fine. Yeah.
Okay. I think we are good with the questions, Sirisha. Do you have some more?
One question I can see, can T1Ds go for teeth cleaning if they have black stains?
Yes, they can go. They can go for, yeah, no problem, because it's very safe and it's very superficial. We do it with ultrasound scalers, where only ultrasound is used. So the scaler is just vibrating. So we don't even touch anything. So you can just you can safely go for cleaning, even if you are, if you have fluctuating blood sugars, you can still go for it. Yeah.
Okay. And toothpaste for T1D children, I think we covered it, right?
Yes, I did.
I think any toothpaste without
Yeah.
sugar.
Any toothpaste, yeah. And then you did also ask me about the root canal procedure. What are the precautions to be taken? Somebody had asked, you had just pinged me about that. Yes. So this is for the elders, who are type 1s. For a root canal procedure, you need to keep 3 things in mind. One thing is that, see that if you are going as in fasting, like just before food, if you are going, is not recommended according to me, because a root canal procedure can take at least 30 to 45 minutes, right? So you should not go when you are khali pate. You should have something and go. One thing. Another thing is, we will give an anesthetic. We give a local. So we don't want anybody to be on fasting. So you need to eat something. So you eat properly and see to it that you eat just enough so that your sugar levels are within 180. Yeah, because if they are above 180, then you can go for an infection, because we are going to drill and remove that nerve and all. No? So if the sugars are high, with whatever precautions I'm taking, sometimes you can land up with an infection. Then you'll have to take antibiotics. You can have an abscess. So we don't want all that. So what you do is go with enough food to eat. I mean, enough in your stomach, where your levels will be somewhere near 180 to 200. Okay, not more than that. That is one thing you should do. The second thing about root canal is, what you can do is, tell the doctor that, see, I'm a type 1, so that in between, suddenly you have a drop or anything, he knows, he needs to keep asking, are you fine, because we keep your mouth open and we keep drilling, and suddenly he's feeling tired, or he's feeling giddy, he's going into a hypo. So we need to know. So he needs to tell him that this can happen. Keep the hypotap or a glucotap somewhere close. And you can even, most of the dentists, we have a glucometer, but sometimes they don't have, take your own glucometer. Feeling low, tell him to check. I think that is one very important thing which is required when you are going for a root canal, right? Yeah. And if he has prescribed some antibiotics, please take them, because always there is a chance of you going into infection. So he would have given you pre and post. He would have given you a 3-day, 4-day antibiotic. Please take it. Yeah. This is for a root canal.
Dr. Avanti, there was I saw some ad saying that there are tooth wipes. So are there any important? I mean, could people use it after taking Glucovita or glucose?
Yes. They can. I think Tooth wipes are good, but I don't know whether they are available in India or not. I'm not very sure. Because I haven't heard of them, or none of the medical reps have told us to. They have not marketed it, at least to the dentist as of now. So whether it's available in India, I'm not sure, but tooth wipes should be fine. They'll be good, I think. Yes, yes. Otherwise, we can only take a piece of cotton or a tissue paper, make it wet and wipe. Yeah,
Yes.
yeah, yeah, yeah.
And
Correct.
one last question. It is not related to oral care,
Yes.
but there is dental stem cell preservation. Right? Some people
Ha ha ha.
preserve.
Yes, yes,
So
yes,
how
yes,
is
yes.
it? Is it the main question is that does it get preserved for so long? Like we are looking at 25 years from now or something like that.
Yes, yes.
So is
Yeah,
that right?
yeah.
Whatever they are claiming, is it really?
Exactly. Actually, because I was thinking now in another 2 years, Pari will be 6 years old. So should we, save her teeth? So I actually asked my Bombay friends, all those who are doing their super specialization, and they are dean of all dental colleges and all. So I asked them, I said, do you think we should preserve? But actually, then they also said that, it's all in a very nascent stage. So they also are not very sure about this dental stem part. But dental stems, they want a live teeth, no? So when the tooth is just about to fall, you need to quickly preserve it. So all these, there are a lot of, as they say, there are many a slip between the cup and the lip. That's what they say, isn't it? So we are not very sure about the dental stem. It's very nascent, and they are doing it, but I don't know how far, because even the bone, that stem cell for bone, no, they are using it for all these all these cancer treatments and all. Very often, a lot of time they land up with failures, and they don't really. So we don't know, but I don't know. It's a very nascent stage. They're doing it, and they are using it for this, for criminal printing, and also they're doing it like each step, each tooth has its own like a fingerprint. No, it's very unique for each person. So I don't know. We need to save the own child's tooth. Yeah, we cannot take somebody else's.
Yes.
So
They take the
yes.
pulp of it. From what they
Yeah.
explained, they take only
Yeah,
the pulp
exactly.
of it.
So we need to, take a live tooth. That's what I'm saying. It's just about, we need to, because the pulp is there only on a live tooth, right? So
Right.
that means we may have to extract the tooth, or we may have to, just when it falls, we have to keep it. So I don't know how far it's going to really work, Yeah.
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 We
yeah.
always have his hope somewhere.
Exactly. I've been trying to, if I come across something, I'll share it in the group. Yeah.
Sure,
Yeah.
definitely.
Right.
So
Thank
that's
you
is
so
it
much,
done?
Dr. Avanti.
Yeah.
Yeah, we have no more questions.
Okay.
We're done
Thank
with
you
all
so much. Yeah, I hope you enjoyed this, and I hope it was not. Yeah, I hope it was not boring. Yeah.
No, not at all. It was
Yeah.
highly educative. And I should say
Okay.
your PPTs with all the pictures, they're very, very attractive. And kids, I think kids must have loved it. And it
I would
was
like to
going
hear
to
from
their
one or two
brain.
kids. I know. I would like to hear from one or two kids. How they felt and whether they understood what I said. Can somebody tell me, kids?
Yeah, you
Unmute.
can unmute yourself and
Unmute
please
and tell me.
let us know how is this session.
Yeah.
Did you learn anything new today?
Can someone unmute?
We have Siri, we have Adya, we have Akshara, Pari. Oh, Pari is Shama, right?
Yes.
Yeah, I can see some kids, but I don't know.
Okay. Yeah.
Someone please unmute. Siri has been very, very, she and Ganesh, right? Both of them have been
Yes,
following.
I
since
can
the
see
beginning.
somebody has, put that video on. I
Adya,
can see. Yeah. Is that Adya?
Adya,
Yes.
you want to share something?
Can you unmute?
No, ma'am.
Okay. Did you enjoy the video? I mean, did you enjoy the session?
Yes, ma'am.
Okay. Will you do that? Will you do gum massaging and all that what I told you?
Yes, ma'am.
Okay then. Okay. Yeah, I want all the kids smiling.
Will follow
Yeah.
today from today.
Yes. Okay. Yeah. Thank you so much, Sirisha,
you.
for giving
Thank
me
you
so much
so
of time.
much.
Yeah. Okay.
Thank you so much,
It's a
Dr.
wonderful session. Thank
Thank
you so
okay,
much.
Madhumati. I also enjoyed myself. Thank you.
Thank
Bye.
you. We'll
Take care.
share this recording. Thank
Yeah.
you. Bye-bye.
Take care. Bye-bye. Take care.